Hey everyone, this is Hannah with the Rocket Miner giving you today's news update. Once again, most of our main news today has to do with COVID-19, so I'll kind of be focused on that, giving some new updates that we've heard around the state and here locally. As far as the numbers go for the state of Wyoming, we're up to 2,072 confirmed cases. And here in Sweetwater County, we're up to 208 confirmed cases. So for the state of Wyoming as a whole, this is up by about 43 since yesterday. And for Sweetwater County, we're up by about 5. For the state of Wyoming as a whole, we have around 580 active cases right now. So all of these numbers have continued to go up. Just looking at the numbers as I check them, it seems like our statewide confirmed cases are going up by approximately 30 a day, somewhere around that range. Seems like in Sweetwater County we usually have at least a few new cases each day, and it seems like the active case number also keeps going up for the whole state. And you have to think, as the confirmed cases go up, we also have the recoveries that are going up as well, thankfully, and so that influences the number of active cases, so you have to kind of look at that trend, but in general it seems like those active cases do just keep rising and the average number of those just keeps getting higher and higher. According to the Washington Post, they said Sunday capped the deadliest week in the United States since the end of May, as more than 6,300 new coronavirus-related deaths were added to the national toll. So thankfully here in Wyoming, we still have a really, compared to other states, a pretty low death total. We're still at 25, but we are seeing more deaths, and that number keeps going up around the nation. For Wyoming, Governor Mark Gordon is going to be holding another media briefing and giving another update on where our state's at with COVID-19. That will be tomorrow at 3 p.m., so you can check that out on the Wyoming PBS pages, their YouTube and Facebook, and we'll share it on our Facebook page as well. Some good COVID-related news locally is that Castle Rock said in a statement on their Facebook page today that they are still COVID-free, which is awesome. So Castle Rock Rehabilitation Center and the VIA there in Green River, they had a staff member who tested positive with COVID-19 2 weeks ago. In the last 2 weeks, they've done over 330 tests of other staff members and residents. And yeah, today they announced that with the results of all of those tests coming in, they are still COVID-free. And they said that they're going to continue to keep doing surveillance testing. Today we also got some information about masks that are going to be sent to schools around the state of Wyoming. So the Wyoming Office of Homeland Security, the Wyoming Department of Health, and the Wyoming Department of Education are teaming up together, and they announced their joint effort to deliver 500,000 face coverings to school districts around the state. They said these will be cloth masks that are washable, so they'll be reusable. And they said this will help school districts meet safety needs for reopening schools this fall. According to current state public health orders, face coverings are required in schools when 6 feet of physical distancing is not practical. They said this needed resource is being distributed in early August to school districts across the state through the partnership between the Wyoming Department of Health and the Wyoming Office of Homeland Security and County Emergency Management. So they'll be sending those masks out across the state and giving those to help out schools as they start trying to reopen this fall. Today, Memorial Hospital of Sweetwater County also sent out a press release and gave an update and information and details about the types of COVID-19 testing that are available, different kinds of tests that are out there, and then the tests that are available here locally at the hospital, and some information about the accuracy levels of those tests and more details on what they involve. So they explained that the novel coronavirus, which is SARS-CoV-2, typically causes an upper respiratory disease, and so because of that, healthcare professionals have found that nasopharyngeal testing is the most effective. And this was explained by Mary Fisher, who is Memorial Hospital's laboratory director. They explained that for initial diagnostic testing, the Center for Disease Control and Prevention recommend collecting and testing of an upper respiratory specimen. So what this means, this is the test that we all see the pictures of and hear about, where they stick a really long swab up your nose. They did state in their press release that they do not actually touch your brain. And so they stick the swab up your nose, and that just gets into your upper respiratory system where the disease affects things the most. They also explained that the two different types of tests that are out there are the viral tests and the antibody tests. The viral tests tell you if you currently have an infection, and antibody tests tell if you've had an infection in the past. And the antibody testing is not authorized by the FDA for diagnosis of COVID-19, which they explained why it's less reliable, and they explain more about that a little later, so I'll get to that. Fisher said in the press release, the ability to quickly identify the SARS-CoV-2 virus while still maintaining a high level of accuracy our community deserves is the goal. We aim to use viral tests offering the greatest efficiency rate. As more tests come on the market, we will continue to evaluate them to make sure we are providing the most effective testing for our community. So then they gave a breakdown of the specific tests that are available at the hospital. So there's a test with the Abbott ID Now machine, and this tests the virus at a molecular level and is one that just requires the nasal swab. They said this one's not as reliable or as accurate of a test, so they don't use it very much. It's about 80% sensitivity. So they said they use this on symptomatic patients in the emergency department, the family medicine clinic, and the Sweetwater walk-in clinic. But they have other tests available. There's a test by Cepheid, and I might be pronouncing that wrong, I'm sorry. But this test uses what's called PCR technology, which is the science and the way that it breaks down. It's over my head because I'm not a scientist, but they give a little more explanation in their press release, and you can look up information about how PCR testing works. But that is considered to be the most reliable testing that's out there for COVID right now, is what uses PCR. This uses the nasal swab, and they are using this at the hospital for different types of patients, and they said it's highly accurate and has 99% sensitivity. There's another one, Biofire Respiratory Pathogens, and also uses PCR. It's an analyzer test that uses the swab and also uses respiratory pathogen targets. And they said that this is a highly accurate test that offers 98% to 100% sensitivity. And then there's the antibody tests. But here's the explanation. They said that according to the U.S. Food and Drug Administration, these tests are designed to detect antibodies. They said because the antibodies are part of the body's immune response to exposure and not the virus itself, such testing cannot be used for diagnosis of infection. The FDA also offers results for antibody tests that have been evaluated and a list of antibody tests that they recommend that healthcare providers stop using. And each of the tests has varying degrees of effectiveness. So the hospital, I think you can get antibody tests here, but the hospital is not using that to confirm cases of the virus because, as I said, it's not as reliable. There's also the fact that even if you have the infection, your body can take a while to build up those antibodies to it. So it's not going to help in telling you whether or not you have COVID right now. So the antibody tests are being used for a lot of different studies, but they're not really used to diagnose the virus or to go into the numbers of confirmed cases. So it is important to know which kind of test it is and what the difference is and why. So I thought that this information from the hospital was really helpful. I had heard some of this before, but it was awesome to see the breakdown of what we have here locally and how it's being used and how they're using this information about what's most effective and what's most reliable, so that we can have effective, reliable tests and accurate numbers, so that we can keep up with what's going on with COVID here locally especially. They also mentioned at the end that they're starting to look into saliva collection tests, which obviously would be a little easier if you just have to give them some of your spit than have a nasal swab stuck up your nose. So that's an option they're looking into, but still figuring out how reliable that is and how they could put that into use here. I just want to say, I know that there's a lot of discussion of everything having to do with COVID, and there's been a lot of discussion of the testing, whether or not it's accurate, how much we can rely on it. I think that this was helpful to hear, again, to realize that we do have accurate resources out there, and we can pretty much count on those numbers. I know that not everything is totally accurate all the time, but I think that people are doing their best, and I think that there are a lot of good resources, and it's been awesome to see how our state and our community have been using the resources that we have to do the best we can under the circumstances and to keep up with things. Also, I know there are conspiracy theories going around that are saying that the nasal swabs are implanting things into your brains. Just don't listen to that stuff and don't share that stuff. Fact check, and I've said this before, you know, look up resources, get them from reliable sources of information, and, you know, double check things so that you know what's really going on and what it means, and that you're not spreading false information. And especially, please don't spread conspiracy theories. It just doesn't help anybody. So just wanted to share that information with you guys today. I think it's great to hear about things like masks going to the schools and updates about Castle Rock. I think that despite everything, despite the fact that the numbers are going up pretty drastically still, it's great to hear that encouragement and to see the ways that people are trying to respond and to do what's right to try to get control of this situation and figure out how best we can respond and keep people safe as we continue to go forward. So just wanted to remind everyone, keep staying informed, keep being kind in your responses and discussions, and keep checking back with us for more information. Have a good night.